like how to crack the exam, what are the tips and tricks to crack the exam. By adding these two into your hard work, you can achieve your dream sooner than what you aimed. So we'll see. So the competitive exam preparations, what are the strategies and tips that we have to follow while writing the exams? In the next 1.5 hour webinar, we'll be mainly focusing upon the 6-step strategies to prepare for the exam, which subject need more emphasis based upon the previous exam patterns conducted by various institutes, which subjects need to be more emphasized during the preparations, types of questions we are getting in the exams, the tips and tricks in answering difficult questions, do's and don'ts during the preparations, do's and don'ts during the examination. So the 6-step strategies mainly include the first one, begin studying early. Plan your time for review. So if we have a clear-cut aim, we are aiming some particular exam, we can start preparing for the exam well in prior. There is no need to wait for the advertisement to come. We can start the preparations well in prior so that we can achieve our dream. We all might be working somewhere, so it will be very difficult to balance between the work and study hours. But still, I can assure you that if you really want, you can keep at least 1 hour per day for your preparations. That 1 hour per day is also help you to gain the momentum in the preparations. So obviously, you will be able to achieve the aim without much tension. With confidence, you can face the exam. In case of students, I will tell the students the best time to prepare for the exam is when they are in the 3rd year. In the 1st year and 2nd year, most of the subjects will be covered. Like fundamental subject completely covered, medical surgical, majority of the portion has been completed by the 2nd year. The allied subjects like nutrition, biochemistry, microbiology, sociology, psychology, everything has been completed by 2nd year. So in the 3rd year, along with the curriculum, if you start preparing, in the first attempt for the competitive exam itself, you will be able to crack the exam. So start preparing well in prior, and once the advertisement is released, you have to plan the 1 or 2 months which is remaining for the exam with tricks, like how much time has to be given for each subject, and make sure that there are days remaining, or there are days you planned for last minute revision for the golden points. Understand thoroughly the terminologies related to the subject. So in each subject, there may be n number of terminologies which may be confusing to us. So it should be very clearly, and you should be able to thoroughly differentiate between those terminologies. Like there is something called disinfection and sterilization. You should be able to make out what's the difference between these two. Or there is something called ischemia and infraction. The terminology both will look like same, but exactly the ultimate meaning of both are different. The management is going to be different. So those tricking or confusing terminologies, you should be very clear. And what is it and how is it going to be managed? You should have a very good idea regarding that. Understand the basic concept and theories of nursing. Here comes, whenever you are learning something or whenever you are facing a question, rather than just asking what is it, you should have always a striving mind to answer why and how it is. So if you are able to answer why and how, I'm assuring you that you will be able to answer the same kind of question at any point of time in the future. Like if there is a question regarding oxygen administration. As we all know, whenever there is a hypoxia, we'll be going for the oxygen administration. That is what? Whenever there is a hypoxia, we want the oxygen administration. But beyond that, if you think like humidified oxygen administration is needed for the child or for a client, why it is? Because it helps to prevent the drying of the mucosa, as well as it helps to increases the comfort of the client. So always think what, why, and how. By thinking in this way, you will be able to answer any question at any point of time without any doubt. Be sure about normal values of biochemical, physiological, and hemodynamic parameters. So the ABG analysis value, LFT, RFT, electrolyte normal values, everything should be at the tip of your tongue. You should be able to recollect those values at any point of time. Because there are so many questions which is related to the clinical aspect, the clinical scenario-based questions or NCLEX-based questions. So these normal values will definitely help you for solving those questions. So by hearting these normal values is very much needed while attempting any competitive exam. Reinforce studies with audio video material. So if you have any small videos or anything related to a specific topic or a subject or a concept, it is better to go for that video, because the video has a long impact or more impact on recollecting and making the memory. So it is always advisable to go for some app-based videos or some app-based practice, so that it will be help us to retain the knowledge more. And moreover, whenever you are preparing the notes, we all have a habit of making the notes while preparing. So while making the notes, make sure that you are using colored pens, different colored pens you are using for preparing the notes, because these colored pens will help you to recollect the information very quickly in the later part. So make sure that you are using very colored pens for preparing the notes, and for highlighting the concept in the book itself, we have to use different colored highlighters. So at the time of exam, we will be definitely able to remember the highlighted part with the color of the pen which we used. So it will be helping you to recollect the concepts. Then practice sample questions. Even though you are 100% confident that you have completely revised the theories, practicing questions are very much important. We may be able to good in theory, but applying that same theory or the concept in a question is going to be challenging. So practicing questions make you have more idea how to solve the question, how to critically think, and it will eventually boost your confidence in solving the questions. So practice maximum number of questions, and while practicing, not only look for the correct answer. If you are able to solve the questions, it's well and good. If by chance you are not able to solve the questions, try to understand how that answer came there. And along with the answer, the remaining three options, why it is not the correct answer, that also you have to check. So by solving one question, you are going to get 4 question answers. So this should be the way of practicing the questions. So the remaining things Sir will be dealing. This is a 6-step strategy to prepare. The remaining strategy for proceeding with the competitive exam, Sir will be discussing. Over to you.
Thank you so much, ma'am. Ma'am, I would request sir to please continue.
Yeah. Thank you, Ms. Ambly. So I'll continue from here. So now she has just introduced what are the, what about this webinar and what are we going to discuss. In that, only first thing is that what are the 6-step strategy, you should keep it in mind. The most important part, more important part of this webinar we are going to deal now. First of all, we'll start with the which subject need more emphasis. This is the very common question whenever I talk to students or any students comes to take any help. This is the most common question they ask, sir, which subject I need to focus more, which subject I have to put more time and emphasis. So my straightforward answer will be that all subjects are important. You cannot ignore or neglect any subject, but you should spend some subject more time than the other subject because the content is more. For example, if you take medical surgical, even in your BSc syllabus, 3rd year and 4th year, there are medical surgical 1 and 2. So the number of hours of instruction and the clinical instruction is more in medical surgical. So obviously it is expected to, one is expected to get more questions from medical surgical, followed by fundamental of nursing. I would give equal weightage to community health nursing, pediatric nursing, psychiatric nursing, and OBG. But these 4 subjects equal weightage. First is medical surgical along with pharmacology. Sometimes it is very difficult to classify pharmacology or medical surgical because it will be an applied question. So if you see the formula, so the table which I presented, you won't get this data anywhere else. I'm telling you, in the last 9 notes that all the question has been analyzed and categorized into subject wise, and this table is made. Okay, along whatever the question, through a memory based recall question only, because obviously we don't get any question, you all know. So from the memory based recall question, after a thorough analysis, we found that 10% from medical alone, 8% from surgical, and pharmacology 8%. So medical, surgical, and pharmacology together, I call it as a medical surgical with a little bit of pharmacology, is forming 26%. That is roughly 1/4 of your paper. in 100 question, I'm talking about only nursing, in 100 question paper, roughly you can expect 25 questions from medical surgical, including pharmacology alone. So you know how important it is. So you have to put more time into it. And sometimes even sometimes difficult to differentiate fundamental of nursing from medical surgical, because it will be applied questions, sometimes related to oxygen device, sometimes related to a procedure which involves positioning, maybe related to medical surgical as well as with the fundamental of nursing. Maybe primarily it is a fundamental of nursing skill, but maybe associated with the medical surgical case. So sometimes it is very difficult to differentiate. But again, the weightage of fundamental of nursing is 16, because that is formed the basic of your nursing practice. Now you calculate medical surgical pharmacology along with the fundamental of nursing is 42 percentage. 26 plus 16, it is 42 percentage. That means 40%, roughly 40% of the paper is with this only, fundamental of nursing, medical surgical, including pharmacology. You know how important these subjects are. So you should leave no stones unturned to focus on these subjects and practice more and more questions. When come to community health nursing, it's roughly 11 percentage. Pediatric nursing, 19 percentage. And sometimes pediatric question, some neonatal related question may be overlapping with the OBG. So together pediatric and OBG forms around again 30% of the 19 percentage from pediatric and 12% from OBG. And psychiatry, usually among all these subjects, usually psychiatric questions are less, what I believe, usually 7 to 9 percentage, 7 on the lower side, 9 on the higher side. But psychiatric nursing itself, number of the questions comes from area is very easy to isolate and study. For example, the defense mechanisms and the theories, the developmental theories. So on psychopharmacology, lithium, there will be a question. ECT, there will be a compulsory question. Psychiatry, even though 7 to 9 questions, it is very easy to shortlist on 30 to 40 topics. You'll be able to strike all those questions. That is very, very important to understand, because when you are preparing for MCQ, it is not about studying entire content. It is not studying little bit about everything in the book. For example, if any one of you, all these aspirants present here, and if I ask you to write about diabetes, you will be able to write 5 pages about diabetes without knowing about diabetes. That is how you are being prepared for writing the essay type examination, the university examination. But the moment I ask a very specific question, which type of insulin used in this type of diabetes, you will think twice before answering. You will not have a pinpoint answer to that question. That is about, see, if you read very little about diabetes superficially, you will be able to write 5 pages, but if I ask 2 pinpoint questions, you will not be able to answer. It is the preparing for MCQ is all about studying more and more about less and less. That means you have to focus and select the most important topics. That means the high yield topics, and about the high yield topics you must know everything. For example, let us take an example of ABG analysis. There will be, whoever attended already examination, you must have seen the question, ABG question, in at least one question directly or indirectly in any paper. So that means without knowing ABG analysis, don't even go to the examination. You have to thoroughly prepare about ABG, the basics, I mean the normal values of ABG, and what is alkalosis, acidosis, metabolic, respiratory, compensatory, partially compensatory, and not compensated. All these concepts you have to thoroughly build. If you know this, you don't need to even repeatedly prepare this. Go to any examination, face one question related to ABG directly, or sometime indirectly one more question also. You'll be clearly without much wasting much time, you will be correct in that question. So you can focus on other question which you don't know the answer. You can spend more time on analysis and all. This anatomy physiology may be only 2%, but maybe the knowledge of anatomy physiology, biochemistry, and microbiology fundamental, very, very important. That knowledge will help you solving many other questions. For example, if you are thorough in microbiology, it is very easy to solve many of the community health nursing communicable disease related question. In fundamental of nursing, infection control related question, you will be able to solve if the moment you have thorough knowledge about microbiology. Biochemistry, all the normal values and all the nutrition related biochemistry also I'm talking about. If you know all these things, you will be able to solve many other questions which is applicable to fundamental of nursing, even pediatric and medical surgical related. Anatomy physiology, basically it is very, very important. That will build your medical surgical knowledge. So whether, even though it is this low percentage, less percentage, altogether forms 5%, that indirectly contributes to many other questions. So be thorough about that. Research and statistics, usually 1% or even less. For example, in last 9 NORS set, especially for nursing officer examination, only 8 questions has been asked. But if you look at the nowadays, every examination is competitive. Even associate professor, assistant professor examination for selection for AIMS, there is a competitive examination because of the number of applications are very high. So in those examinations, the proportion of research and statistics questions are relatively high, but in this particular examination, usually this is less. And nursing officer, I found only 8%, but when you move to any other examination, even senior nursing officer exams, the percentage will go up to 3-4%. Even faculty examination and all, it will be 5 to 10% of question will be from research and statistics. Even sometimes it is more. So depends on your need, you have to focus on these subjects. See, for example, this is further division of each of the subject into the topic. See, dietary allowance, contraceptive method in OBG, for each of the type of concept, how many questions came in each of the NORS set 4, 5, 6, everything, and totally how many questions. For example, 6 question has been asked from one particular topic, that is anemia Mukh Bharat, or question related to anemia. 6 question has been asked in the last 9 NORS set. So that means this topic you spend more time and be very, very thorough about before going into any examination. Look at the fetal lie position and presentation. Okay, look at the fetal lie and positions. You find again another 6 question. See, 6 question from fetal lie position and presentation. 6 question from drug contraindicated in pregnant women. So these are the area you must concentrate and prepare well. So for more information, these informations are given in the book. You can go through that, but this kind of knowledge will help you to focus what topic is more important. For example, only one question from certain topic you should not ignore, but you can keep it as a last option. The high yield topic should be prepared more thoroughly, more time to be given, more practice should be taken. For example, you take quickening. Quickening is very what can be asked in quickening. At what time the quickening start? The mother feels quickening. 4 questions came in last 9 NORS set. Very simple. In 5 minutes you can complete the preparation about quickening, but there are 4 questions in the last 9 NORS set question. So such topics you should not miss and prepare well. That's what we would like to tell about the subject you need more emphasis. Very, very important in the planning phase. Even when you are preparing now and you are halfway of preparation, you are applied for next NORS set, please focus these topics and subjects accordingly. Then comes to the multiple choice questions type. Always the question which you are undergoing are single response type only. Single response type means there will be 4 options, out of which 1 option will be correct. That is a single response type. And if you are writing NCLEX type of examination, you will see multiple correct answer response type, where there will be more than one correct answer. For let us see an example. In following is which of the following are the cardinal signs of diabetes? They will give some 7 options. You have to tick what are all applicable answer. That sometimes 2 may be correct, sometimes 3 may be correct, sometimes even 1 may be correct. They may not give how many are correct also. They give 7 options. You have to tick all that are correct. Sometimes 4 correct, sometimes 3 correct. This type of questions are very, very difficult because you do not know even how many correct answers are there. Second one is you need to have comprehensive idea about the subject. Otherwise, you may tick it 3 correctly. You may miss 1 correct answer also. But fortunately, this type of questions are not asked in the competitive exam, either ESIC, NORSET or RRB. We don't face this question. Only once in the past, I think somewhere around 2018, 17-18, AIMS RISC case, there was one question with all these NCLEX type of multiple correct answer type and all. But that exam later got cancelled because no one qualified in that examination, because no one crossed 50% mark due to the difficulty level of examination due to this fact itself. So among these MCQs, you see type of question. One is a recall type. Recall type, often you depend on the questions where factual knowledge. Which year TNAA started? Okay, in which year the MSc program in India has started? The normal values are recall type. The year, the name of the author, the name of the bacteria or virus for certain diseases, the incubation period, the drug of choice. These are all recall type. You don't need to analyze the question. There is an answer. Sometimes even if it is an applicable scenario based question, it will be finally recalled, but because you need to know only one thing to answer that question. They will give about the patient with so and so condition brought to the emergency, patient with poisoning, paracetamol poisoning has been brought to the emergency. Which of the following is an antidote of paracetamol? Only one thing what you know is that these questions are like applicable question, but not very much applicable. It is actually a recall question. You need to know what is the antidote to the paracetamol, nothing else. So you will be able to answer the question. For this, you have to memorize and use a lot of mnemonics to memorize this, and you have to be very clear about what you know without any doubt, so that you will not get into any negative markings also. Second is rational type. The rational type of questions are most often comes in N class, but also in a case-based question it is being asked. The beauty of rational type question is that in the question itself there will be answer, but you need to tell why that is correct answer. Okay, because for example, they will give a patient comes with the paracetamol poisoning. I'm giving the same question. Patient admitted into the emergency, brought to emergency room with the paracetamol poisoning. Upon history collection, it was noted that the paracetamol was taken 6 hours before. So the nurse prepared to give means antidote instead of charcoal. The reason, what is the reason? Okay, so that means question is given, answer also given, but you need to know what is the right rationale for giving antidote instead of charcoal. Charcoal is also an antidote, but N-acetylcysteine is the actual antidote. Other one is just to prevent the absorption. Why one have to take this against that? That you have to find out. For example, okay, beyond 4 hours already all paracetamol might be absorbed, so that you have to go for N-acetylcysteine. N-acetylcysteine. So this rationale you must know to answer that question. So the rational type question require you to know the rationale for any nursing intervention. To build this area particularly, whenever you read any nursing intervention, also read the rationale. If many questions nowadays, the trend is that more scenario based question, N class based question. If you have to be confident of facing such case based N class type of question. Build the rationale. Whenever you know the intervention for some problem, also know why that intervention is appropriate. That is called rational. Then comes application and analytical. Mostly the application and analytical questions are like drug dose calculation. And a given scenario, what will be the most priority nursing? This question you often face in a given scenario, which of the following is the most priority nursing care. For that, you need to know what is the most important priority. The techniques I will tell you later, the ABC principle, nursing process principle, actual to potential principle. I will discuss it little bit later, so I move on. Okay, next is the assertion and rational. So far, the assertion and rational type of question never been asked in any of the examination, but nowadays the ESIC examination being conducted by UPSC. The UPSC in their system, usually they include this assertion and rational type of question. Of course, in the last examination there was no such, but it cannot be the same for future. There may be a possible assertion and rational type question where assertion will be one statement, rational will be other statement. So assertion will be like, for example, they give one assertion, a statement, and they will give the reason for that. Let us take the same example. The nurse, when the patient comes with the paracetamol poisoning after 6 hours, the nurse is advised to give N-acetylcysteine. Next rationale is given that N-acetylcysteine is more effective than charcoal. For here you see the statement first is correct, but the rationale is not correct. Actual rationale is that after 4 hours, the charcoal is not effective because all paracetamol might have been already absorbed. So that is the right rationale. There will be assertion, there will be a reason. Assertion statement A, rational statement or reason it will be given as a reason. Reason statement will be B, the R. So sometimes A is correct, R is wrong. Sometimes A is correct, R also correct, but R is the correct, not the correct explanation of A. Sometimes A itself wrong, R may be right. So this is somewhat a very complex type of question. Unfortunately, so far this type of question not asked in nursing. but who knows, it may be asked in future. That's why in Target I 8th edition, I have included, I think, 60 questions of this assertion and rational type of questions in the newly published 8th edition. You can get a glimpse of it, and you can develop more questions and concept on your own also for this assessment, because don't take it granted at all. Before 2016, there is no such image based question in any of the examination. Before 2016, there is no such image based question. 2016 January, we published the first edition of Target type book, where I have introduced 200 image based question based on instruments, the oxygen therapy, the positioning, the oxygen therapy devices, all those things. We have introduced 200 image based question when it was published in 2016 January. And in the September 2016, that time there was no NORSET. The AIMS conducted the nurse recruitment examination for AIMS Delhi. In that, there were 10 to 12 image-based question asked in the September of 2016. That is the first ever time the image-based question comes, because before that there was some paper-based examination. And when the computer-based examination introduced, I thought, I predicted that it is possible they may introduce images in the question. So I have added presumptively, means expecting that, but fortunately that year itself there was an image-based question in the exam. So that was very useful. Then finally the matching questions. The matching questions in the recent DSIC, lot of matching questions were there. Then one side they will give certain thing, for example, signs and symptoms. The other side they will give the disease name. Okay. Like pain and McBurney's point, other side appendicitis. Like that, you'll be able to match our disease condition and our microorganism which is causing the disease condition. I mean, communicable disease and the organism which causes, or disease on the other side, incubation period, or the disease, a drug of choice. There will be 4 options this side, 4 options other side. There will be different combinations of matching given. This type of question somewhat easy if you know at least able to match 2. One matching, you will have the 50% chance of getting right. If you are able to match at least 2, the rest you will be able to match, because the combination and permutations are only 4 combinations will be given. From that you will be able to pick up. If you are able to match at least 2 things, you don't need to match all 4. This technique you know from your school days also. Matching, if there are 5 matching, you are able to solve 3, and 4 and 5 somehow you will be able to manage at least with the 80% accuracy. Then multiple correct answer type question we have already discussed. It is no more being asked in the NOSEP kind of examination. But if you are preparing for NCLEX, be sure about it. What are the approaches? First of all, time management. Plan out a timetable which is feasible. See, no matter when you are starting, if you are an undergraduate student, best time to start around 3rd year and spend at least 1 or 2 hours every day, so that you become more and more familiar to solve the MCQ. As I already told you, these two are totally different. Playing test match cricket is different, and playing 2020 cricket match is different. So you may be a very high scorer in your university examination. You may be having a very good handwriting, very good presentation. You'll be able to write about any essay for 4 or 5 pages. But when it comes to MCQ, that is all different ball game. So you have to develop the strategies to solve MCQs. Of course, hard work definitely plays, and the basic knowledge and the fundamental knowledge is very, very important. Also, you need to develop certain strategies, face, your time. You need not waste much time in some questions. Time management. There are many things you need to develop. For that, you have to start early and utilize time wisely in the preparation. And always challenge yourself. You don't need to compare with someone else. You have to challenge yourself. Last time you are taken a mock test, you scored 60. Challenge yourself. Next time I'm going to get at least 10% increment. It is going to be 66. Challenge yourself. If you are not 66, you challenge yourself. Next time at least I will score again 66. You have to set target on yourself. Don't compare others. That will lead to some frustration. Even some of your friends get selected, you did not get selected in the same examination. Don't compare where you went wrong. You analyze, you challenge yourself, develop strategies to improve that. You may be 5 or 10% less than what is expected. You fill that gap. And audio dual aids helps memory. This was discussed already by Ambli madam. You all know that more audio visual and more, when you use more than one sensory stimulation, the probability of retention is more. For example, if you only see and if you read, both there are, if only you read, your memory is 50%. If you read and see, for example, if you listen only, the memory is only 25%. You listen while watching the text also. That's why most of the YouTube videos are now, even though you are watching, even though you are listening, they also put a subtitle, because that enhances another 5-10% of retention. So use more sensory organs. That means watch, listen, as well as read. More sensory organ use, more you remember. If you touch, like when you are learning certain nursing procedure, you touch and do it, then you definitely don't forget at all. So more, involve more of your sensory organs. So strengthen your basic understandings of subjects. Do not leave anything for the last minute. This also again discussed with Ambli madam before. So don't see last minute preparation. Only if you're extremely lucky, like you're playing a casino, you will be winning. Otherwise, unless you have a specific strategy and planned preparation is done, it is not going to be guaranteed of your success. You don't leave it for last minute preparation. Don't expect to be extremely lucky to be successful. That will happen 1 in 10,000 or 1 in lakh person may be lucky enough to get it. It is just like a winning a lottery. So prepare short notes of your own for your own revision. Whenever you prepare, no matter what book you are following, prepare your own notes using certain scribbling pad or something with a color coding. So that will help you in the last minute. So follow the book, read some important point, underline also. But if you make your own notes from that, last minute for me, last one day, you can quickly go through that. So whatever you prepared for last 6 months or 1 year, you will be able to recall in a nutshell quickly before going into any examination. That will boost your confidence, in fact. Then comes consistent practice. Practice daily. Let me tell you, if you practice 50 questions in a day, in a year of 365 days, leave 150 days for your 165 days for your lesser time. You are very busy person. But if you practice 200 days, 50 questions in a day, 10,000 questions are solved. From the nursing question bank, if you be thorough with, of course, with all subjects covered, if you are thorough with the 10,000 good questions, the 80% of the question will fall from this only. They cannot ask outside this, because the nursing curriculum and the syllabus is limited. If you choose the right 10,000 questions and keep repeatedly practicing it, and even if they're beating around the bush, ask in a different indirect way, you will be able to solve those questions. So consistent practice is very, very important. And especially if you are practicing question, once you're wrong with one question, the same question given to you after 6 months, again you will be wrong in that question. Once you go right in a question, 100 times I give you, you will be right, because you know the concept, you know something about that question. If you gone wrong, so whenever after taking any practice, go to the wrong questions, why you went wrong, what strategy you have used, what is the reason for you got it wrong, analyze that and solve that problem. Then next time that question is given, immediately you'll get, okay, last time I was wrong in this question because of this reason. So you will never forget that question. So even I tell you, personal experience, I written so many examinations so far. Okay, whenever I come out, I will be able to recall only the question which I went wrong. I will never able to remember even which question I got it right, because I don't even bother about that question, because I know confidently answer. I take it, I move to the next question. Whichever question I did not answer well, I have a doubt, and also I spend more time in that question. Once I come back, I'll be able to recall only the question which I went wrong. That question you need to practice, which concept you did not know, so that you went on wrong on that question, you again prepare for it. That's all. Then stick to the schedule. You make some schedule. For example, 2 months for F1, next 3 months for medical surgical, 1 month, 15 days for medical surgical, MHN, 15 days for community. Make certain timetable, and make certain, during the timetable, theory also is to be included. Along with that, you need to practice at least 50 questions in a day. So stick to the schedule strictly. This is how the MCQs are framed, so that you need to have understanding of this to have a better idea how to solve the paper. First of all, it is following the Bloom's taxonomy of all the aspects of Bloom's taxonomy, that is cognitive. The cognitive domain, mostly your knowledge is tested. Okay, so it is based on the learning objectives of your BSc program and following the Bloom's taxonomy, because your psychomotor skills cannot be tested with MCQ. To some extent, your affective domain may be tested. Mostly your cognitive domain, that is a knowledge domain, will be tested through the question. So you focus on knowledge question, not that much important to focus on skill based question unless you have any skill test. Earlier there was some skill test also. After clearing exam also, one have to undergo skill test. For skill test you need to practice all the skills, but here focus on knowledge. And mostly questions will align with the standard textbooks. So whenever the questions are picked up, those are following the standard textbook. So certain data has to be when you are having any doubt about certain data and parameters, some normal values, you are confused with this book, that book, better follow the standard textbook for those. That will be undoubtedly, without any dilemma, you can go for it if the data is from the standard textbook. Second, commonly derived from high-yield topics. Most of the time the questions are taken from high-yield topics that you have already understood, because I shown the breakdown of the topics from the different subjects. And the frequently made mistakes, because examiner, when they set the question, they make use of frequently made mistakes by the students. Because for example, even sometimes they give a value, pressure, CVP, central venous pressure, or sometimes intracranial pressure. It is all as instead of mm of Hg, it may be measured in mm of centimeter or mm of sorry, centimeter of water, H2 also, right? Not always mm of Hg. So they will just change the unit also sometimes. So they will be looking for the students' mistake from frequently made mistake areas. Then comes to the clinical judgment and practical nursing scenarios. So they will give you a scenario. From there they will expect where you will misunderstand this scenario and make mistakes. Depends on that, they will ask questions. This is how the questions are framed, just to have a clear understanding about. I presented this, not very important for you, this aspect. And here before going into this question, I request the administrator to run the first poll for the students. So then let us.
Yes, absolutely, sir. I request the backend to please run the first question. The first
Not
question in
question,
the
the
poll.
first question. Yeah, first question. Yeah.
The first question is, have you ever written NORCET or other competitive examination? So we are starting this poll. I request the backend to please start this poll. All of you are requested to participate in whatever poll questions we have, because CBS is going to announce the winners from the poll also. So if you participated, probably you'll be lucky. So here's the poll on your screens. I hope it is visible to everybody. Please do participate. We're going to have a lucky draw from among all those who've participated in the polls also. And I'm going to be announcing the winners of the other quizzes also.
So can I see the results of the poll? How can I see that?
So we'll be taking 1 minute time for allowing everybody to participate. The votes are still coming in. As soon as that's done, we'll publish the result.
Yeah.
Okay, so on your screens, once you've answered, you also have the option to modify your answers. You can click on modify, and if you want to change your answer, please give it a thought, modify and change your answers. So no more votes coming in. I hope everybody has participated. I request the backend team to please publish the result. So this question, the most voted answer is they've never participated. They've never taken NORCET.
Great.
About 40 votes, that is 28% we've received for many times they've taken NORCET. 22% is only once they've taken the NORCET exam, and 48% is never taken the exam.
Right. So roughly 50% of the audience sitting here today or never attended examination. I think it will be very, very useful to them. But also people who have written many times, some of you may be successful again, but you are maybe repeating. Some of you may have not successful in your first attempt. For you also, you can improve your strategies in this. That's why it is very, very important. So the next poll also I ask you to run. I am showing the question here also. You can run the next poll. It's very important. I will tell you the reason why this will be the. Which of the following patients should be attended to first by the nurse? You are going to a ward. There are 4 patients, and there are 4 different procedure need to be done. Depends on the handover. Which of the following patients should be attended to first by the nurse? Please give your
I
answer.
request the backend team, please start the poll. And all of you guys, please participate. We're going to have winners from this as well.
30 seconds are enough for a poll. Students are very fast.
So
They'll
they're
be able
very fast.
to.
We've received about 55% people have already participated. So I'd request everybody to please hurry up, put in your answers. I guess, sir, the answers are very clear because 83% people have written a patient with difficulty in breathing and oxygen saturation of
Right.
88% is the answer.
So that means roughly more than 4/5 of the students answered correctly. The see, it is relatively very easy question, but why I presented this question to question is that the point is that you have to follow the principles of ABC. Whenever there is a scenario based question, you have to follow the ABC principle, except in the uh, CPR situation. Wherever there is a CPR, the sequence is CAB. In all other situation, the formula is ABC: airway, breathing, and
Breathing
circulation.
and circulation.
Among these 4 options, C option is about a patient with the difficulty breathing and oxygen saturation of 88%. So there is a compromise. The oxygen saturation is compromised. So immediately that need to be attended first. So you follow the ABC principle. So C is the correct answer. So this will help you to quickly answer the question following the principle. That's it. So we move on to the common tricks and traps used when you are writing an examination. They use the distractors that seem very, very correct. So they will use the distractors somewhat very, very close to the correct answer. See, without distractors, sometimes you know the answer. The moment you see the distractor, I mean, for the new people, I'm telling, correct option is right answer, and the remaining 3 options are called distractors. So sometimes, mostly the distractors used to be very, very close to the option. That's why you get confused. Without seeing the distractor, you may know closely answer also. The moment you see the distractor, you get into confusion. Then absolute terms, always or never in incorrect options. So many a time there will be always or never will be, especially this is applicable to case based scenario based question, where the term always and never will be used. If the always and never term is used in any option in a scenario based question, NCLEX based question, that option is often incorrect, because they use that always and never to make it wrong only, because no intervention can be applied, never applied to any situation. I will show an example later, you will clearly understand. So I don't want to confuse before that. And negatively worded stems, often many people get trapped with this except or not. You may know the answer to the question, but sometimes you overlook this except or not in the question. If there is an except or not in the question stem, you are looking for a negative answer. Which of the following is not signs, cardinal signs of diabetes? That means you are looking for a symptom which is not related to diabetes, or else all of the following are the cardinal signs of diabetes except. That means again, you are looking for a signs and symptom which is not related to diabetes. So you have to clearly understand this term whenever appear. Sometimes there will be a double negative. You have to be very, very careful. There will be one negative in the middle of the sentence, one negative in the last. So if there are double negative, again you are looking for the positive answer. For example, all of the following interventions are inappropriate for a patient with a diabetic foot ulcer, except. That means they say first inappropriate and they said except. That means one negative, then two negative, double negative. If there is a double negative, then you are looking for a positive answer. So this also you have to keep it in mind. And then slightly changed numerical values and drug names, another technique. The options with the close sounding or similar content, and case-based questions with hidden clues. So I give you another question. I ask you to run the next poll. The administrator, please. A 24-year-old woman.
Please run the polls for the third question.
A 24-year-old woman present with fatigue, cold intolerance, weight gain, and dry skin. On examination, her pulse is 54 per minute and BP is 110/60. Laboratory results show increased TSH and low T3 and T4. What is the most likely nursing intervention priority here? A. Encourage fluid intake. B. Administer prescribed levothyroxine. C. Initiate cooling measures. And D. Start salt restriction diet. Read the question carefully.
Please ensure that you've read the question correctly and you're answering correctly. You also have the option to modify your answer. If you think you've answered it wrongly, please take time, think about the answer, and then modify your answers. Click the correct answer, because we're also going to have winners from this poll.
Yeah, I also can see the result. I could see 68% of you answered administer levothyroxine. That is the correct answer also. Still, you see many people have gone for encourage fluid intake. Actually, that is a secondary symptom. It is actually the primary one is the levothyroxine related. It is due to thyroxine deficiency, because the key word in this question is, see, sometimes it may be encourage fluid intake also may be right, but you have to find why they have specifically given this particular data in the question, TSH and low T3 T4, that lead you to the levothyroxine. So you have to understand the keyword in the most important strategy when you write examination. Find out the keyword in the stem that will lead you to the keyword in the options. When there is a direct connection, there is no other option connect looking similar to this, then judging this answer will be very, very easy. So 68% of you gone for correct answer. I appreciate your effort on this. So I will move on to the next one. So some of the tips and tricks I'll be sharing. One thing before sharing all these tips and tricks is, this is only to improve your preparation. Number one. Number two, it is knowing the right answer is the only way to face examination. Only way to be prepared for the examination is knowing the answer. There is no substitution. Again, I'm telling you as a disclaimer, there is no substitution for hard work. There is no substitution for knowing the answer. But what I mean here is that when you go into an examination, no matter how much you prepared, there will be 10-20% of question for which you have no clue. You have not prepared, or that question is from the area which you have not prepared, or it is very difficult. It is not within your knowledge scope. You have not prepared for it. Simple. So, but you are getting into a confusion whether I should attempt this question or not, because there is a 1/4 negative mark, 0.25 mark I will lose if I attempt. If I'm not attempting, at least I get 0. If I attempt, I get minus 0.25. Whether I should attempt or not. For in this scenario, whether you have to attend or not, such a difficult question, you can try out any of the good tricks. If it seemingly, for example, if you are very, very confident about after applying this strategy, if you are confident that, okay, I can go for it, I can solve this with you following this, then go for it. That is the only way. But if you, before using this, you should know the answer. If you don't know the answer, see, if you know the answer to the question, don't use any tricks. Knowing is right way. If you don't know, if without this, any of this strategy, you are going to leave that question. For that question, try to attempt this. For that, don't directly attempt these tricks in the examination. When you are preparing and practicing, if you come across question very difficult, you are unable to answer, follow these tricks and mark those questions. Whether you are possibly getting it right following these tricks, then you get into that practice. Otherwise, straight away go to examination. Don't go to examination and follow these tricks. Sometimes it may be you may be choosing a wrong path. First of all, as I told you in the showed in the previous question, pay attention to the key terms and phrases. You read the stems twice. Don't run away. If there is a negative word like except, inappropriate, not, all those options are there. Underline. There is no option to underline in the computer based question, but mark those words. Then depends on that you judge the answer. Or like the previous question, levothyroxine and T3, T4, such keywords you have to look for it. Look for the adjectives like most, primary, first, initial, least, etc. For example, if you are looking for primary, that means primary, sometimes primary, first, initial. This and all looking, you are looking for the most important thing. Which of the following is which of the initial intervention nurse must do? Maybe assessment. Okay. Which of the following is the first? So first, initial, primary, somewhat very close, different, depends on the situation. So understand this term first. Look for these keywords in the stem. If you are looking for least, that you are looking for the least important answer. If you are looking for the least, which of the following is the least important intervention, then you are looking something very unimportant intervention among the options. Eliminate false answers first. Okay, one strategy is that after reading the question, even before looking at the options, please judge your answer without looking at any of the option. Then you look at the option, whichever is close to your thought, then you analyze the question. That is one way. But if you are, that is when you know the answer. When you don't know the answer but still you want to give an attempt, then only try to eliminate the false answer. Sometimes one of the option among the four options is remotely associated with the stem. You very clearly know, sir, I know the fourth option is not at all correct because I know this is not connected to the stem. Please eliminate it. Then only judge among remaining three options. So that will improve the correct, possibility of correct answer. And also even you can take to attempt it among these three, because the probability of getting it right is 1/3. If you eliminate one option among remaining three, the probability of getting it right, even if you judge, without knowing the answer, you are randomly answering some answer, the possibility is probability is 1/3, but the negative is 1/4. So the the profit is 1/3, the loss is 1/4. So the profit is more, 1/3. Okay. So that means this question you must definitely attempt, because if you attempt 10 such question, 1/3 chance, you may get 3 questions correct. I'm telling you a scenario. Let us assume you are attempting 10 such questions where you are able to eliminate one option. Remaining 3 you don't know which is correct, but still you attempt randomly. The probability is 1/3, means out of 10 you get 3 to 4 questions correct. 3 or 3.3 in fact. So 3 questions, let us say 3 only, even sometime less than 1/3 also, 3 correct. So that means you get 3 marks, remaining 7 negative, that means 1.75 negative. So 3 minus 1.75, still you get 1.25 positive marks. Okay. So that is the probability which works. In fact, if you are little lucky, if you get 4 out of 10 correct, then you get 4 marks positive. Out of 6, negative is 1.5. 4 minus 1.5 is 2.5 positive. So that's why it is important to eliminate false answer. You are able to eliminate one answer, still you can randomly attempt. If you are eliminating 2 wrong answer, you have to 100% attempt, because probability of getting it correct is 1/2. Probability of getting it wrong is, getting negative marking is 1/4. So that you are always on the positive side if you are able to eliminate 1 or 2 options. Just 1 second, let me have some water. Sorry for that. Next is be alert for a question that requires you to identify which answer is incorrect. I already told you what is the option for this, because uh, you have to identify the negative terms like except, inappropriate, excludes. If option have this key term, you are looking for an incorrect answer. Be careful with the double negatives, which I already discussed. If the stem have two double negatives, I will show you one example, then you are looking for a positive answer instead of negative. For example, all of the following interventions are inappropriate for a patient with pneumonia except. That means if it is all of the following interventions are appropriate for a patient with pneumonia except, means you are looking for inappropriate intervention. But question is, all of the following interventions are inappropriate for a patient with pneumonia except. That means you are looking for an appropriate intervention. So because there are two negatives which cancels each other. Evaluate the answers in relation to the stem, not to the other options. Never compare. Sometimes that is used as a strategy. I will discuss at the end that option. Sometimes that strategy is also used, that is as a last resort, not before. Usually you have to read the stem, compare the option to the stem, just like we have done with the levothyroxine with the thyroid level. You have to compare the answer with the stem directly, not compared to the other options. If you compare to other option, you will see, okay, fluid is there, I have to give fluid before levothyroxine. That is what you will end up in wrong. You have to compare the stem. There is a critical point that T3 T4 is less, so I have to give the levothyroxine. You compare the stem with the options, so you will be able to get it correct. Look for the most comprehensive answer. See, if there are especially in a case based question, there will be lengthy options. So if any option is very comprehensive than the other, the most comprehensive answer will be correct. I will show you an example. If you in an option, if you find provide the patient calm and quiet environment, that is one option. Other option is provide the patient calm, quiet and comfortable environment. If these two options are given in the same question, the second, that is more comprehensive than the first, provide the calm, quiet and comfortable environment, will be correct than the previous, because this is more comprehensive than the other. I will show you one example later also for this particular point. Keep it in mind that more comprehensive answer will be correct. I will show you an example that time when going for the poll. I hope 100% of you should be correct using this technique. Most comprehensive answer will be correct. So when we run that poll, I hope everyone will get correct 100% if you are listening to this lesson. Priority decision making. So in most of the clinical case-based question and in-class question, the priority decision making is very, very important. For that, you need to follow either most life-threatening, follow ABC principle except CPR, which I already told you. If there are 3-4 scenarios given, if the airway is blocked, airway is attended first, then the breathing, then the circulation, except CPR. CPR, you all know that as per the protocol, it is compression first. Okay, in CAB, compression, then airway, then breathing. In all other situations, follow the ABC principle. Then first priority nursing intervention. Suction before medication. See, for example, here also again indirectly only ABC only applicable. Medication is there, then suction need to be given. So you need to do suction before giving medication, because the priority actual to potential problem. This is another important question. First of all, you need to follow ABC. If any of the if question is not falling into this strategy, sometimes not all the question you will be able to apply this ABC principle. Then move on to the whether it is following the first priority nursing intervention. For example, if something is more important now and something can be delayed a bit. Medication administration can be delayed, depends on what medication also again. Okay, suction has to be immediately applied. Again, that is again following ABC principle. So there is not much techniques into the second point, because indirectly ABC is applicable. But sometimes neither ABC you can apply nor this technique can be applied. Then you have to come to actual to potential problem. Actual to potential is what patient right now facing problem. What is the problem for the patient right now is actual problem. Even nursing diagnosis you might have studied. Actual nursing diagnosis, potential nurse diagnosis, that is called risk diagnosis. In nursing diagnosis you will see risk for fall, risk for infection, Okay, so the risk for all used to, yeah, but risk for family, so risk for impaired family coping. This can be a risk that can be delayed, but actual patient have pain right now. Patient is having hypoglycemia right now. Patient have altered sensorium right now. That is to be attempted. That is to be addressed first before attempting or before addressing the potential problem. So whenever there are options, the question asking you to which of the following is the priority nursing care, which of the following need to be attended first, apply ABC. If it is not applicable, apply whether it is following the actual to potential problem. If it is actual, that to be attended first. Then follow steps of nursing process. You all know, or whether you are student or completed, we are all immersed with this assessment, planning, implementation, maybe one more intervention and evaluation. Assessment, one thing I am missing: nursing assessment, diagnosis, nursing diagnosis, planning, implementation or intervention, and evaluation. You have to follow this sequence whenever you are asked to, whenever the question asks you to prioritize the prioritize the nursing care. You have to see whether assessment is already done. Sometimes the question itself will have data regarding assessment. There you don't need to do assessment. You can go for, if the any option is related to planning, go for it. If no option is related to planning, only there is an intervention, then with the among the intervention you apply either ABC or actual to potential. Okay, but before that, before applying this ABC or all those things, first of all look at the nursing process, whether it is in sequence. First of all, assessment, diagnosis, planning, implementation, and evaluation. Why I'm telling this? There is a question. Infant is brought to the emergency with the complaints of fever. Which of the following is the first nursing action? Number one, assess the temperature. Number two, is administer paracetamol as per the physician advice. So what will you answer here? First of all, assess the temperature. Though administering paracetamol maybe applying tepid sponge is another option, but you have to go to the rest of the two options only when the assessment is done, because in the STEM there is no detail about the temperature. Complaints of fever, that means parents are complaining of fever, but you don't know what is the fever, what is the temperature. Depends on the temperature, you may give paracetamol, you may give a tepid sponge, right? So assessment has to be done. But if the question itself have the detail, an infant is brought to the emergency with the complaints of the fever. On assessment, the nurse found the temperature is 99.8. Which of the following is the priority intervention by nurse? There you can ignore the assessment. Even if the assessment is there, that is already covered in the STEM, so you can go for the next intervention. Maybe either it is a and here you will apply most comprehensive to less comprehensive. I tell you an example. One option is saying administer paracetamol. Second option is apply a tepid sponge to be given. Here the administer paracetamol is not comprehensive, because whenever the administration of drug comes, it has to come with as per the order, as per the physician order. Otherwise, if the question is asking which of the following is the first nursing intervention, administration of medication without prescription is not the nursing intervention. So you have to see more comprehensive answer. And if there is a tepid sponge, a nurse can decide and give on the tepid sponge depends on the temperature of the baby. So these things you have to keep it in mind when you're solving the case or scenario based question. ABC, actual to potential, and a sequence of nursing process. Safety issue, the patient safety has to be ensured. For example, if you are saving a patient from a fire scenario, first of all safety, so that has to be attended first. Again, that is considerably, which is the most priorities. First comes safety. So can you run the next poll? A patient with multiple injuries, will follow any one of these strategies and solve the question. I expect 100% accuracy in this. If you are listening to this lesson, you should be 100% accurate. A patient with multiple injuries after a road RTA is rushed to emergency ward. Which of the following assessment takes assessment? Sorry, which of the following assessment findings request immediate intervention? Immediate intervention is the keyword. Now you find out which is immediate.
you please participate in the polls.
Only 87 are participating. Others, I want everyone to participate. Let us see.
Please
Everyone has.
participate in the polls. If you happen
Yes,
to
I
be one of
know.
the lucky winners, you
I will be able
might get a
to solve. I
chance to
will be
win.
able to give you more, concepts only when I know how much you know. $110 answered. So others are not interested to participate. Fine. Okay. Let us freeze and see. Can we publish the result?
Please
I
publish the
myself.
results.
Yeah, yeah. Yeah, when I can see 60% of them are correct, going for a deviated trachea. And second option, the second most common answer is irregular apical pulse. I understand why you went, because we talk about A, B, C. A is deviated trachea because there is a building up of pneumothorax. In the road traffic accident, there may be a chest injury. So the building up of pneumothorax, which pushes the trachea to one side, so that's why the deviated trachea occurs. That need to be immediately attempted. Maybe some intervention has to be immediately done to remove the pneumothorax, so the patient will be able to breathe normally. The irregular apical pulse comes next. Some of you have given even unequal pupils come, so that even comes later. First of all, you have to go for the deviated trachea in this particular scenario. So I am happy that 60% of you right, and I think the second comments 24% you should be able to improve following this technique, that ABC means you have to go for A first. So very good. If you are in next attempt, I think we will reach 80% plus at least. Next question. Okay, so we move on to the next slide. Best and most tested way to improve success ratios to study carefully. This I already told you. There is no good alternative for knowing the right answer. However, there are certain methods which can be helpful, like what we have discussed so far. So we'll discuss little more. Try to presume the right answer before you are distracted by seeing the options. You read the stamp, guess the right answer, then read the options. Don't read the options straight away. Read the question, guess the answer, and read the option or uncover the option if it is a paper-based question. Then you see whatever is the close to your what you thought. If you see that response that you anticipated, mark it and then review other options and be sure none of the other responses is better. First of all, you thought some answer, then you read the option. Some answer is very, very close to what you thought. It may be right, but don't freeze it. Before freezing it for as an answer, then look at the other option. If any option is looking to you, if any other option looks better than what you thought, then analyze, then finalize it. If you do not see the anticipated response, follow any of the strategy which we were discussing, and I'm going to discuss some more also. So if any of these works and you don't know the answer, then you want to attempt the question, then use any of the principles we were discussing and what going to be discussed. Distractors that use absolute words such as never or always, and there are questions with the distractors that use conditional words like probably or usually. If you get, I will give you an example there, you will understand. If you get one option where never is given, other option where there is always, and there are other other options where probably or usually given as a keyword, then the probably or usually, the options with the probably and usually should be given more importance than the never or always. Okay, I will come to the question, then you will understand. Then all of the above is often a correct response. See, when you have any question, first of all, you try to recall, you don't know the answer, you try to uncover the option, then see, then compare, nothing worked, you don't know the answer. But in that question you found last option is all of the above. But in a computer based question, all of these they will give, because in the paper based, last option will be all of these, all of the above. But in a computer based question, the option may be shuffled, that's why they give all of these, or some all of these also will be given. Then all of the above option is most often a correct answer. Not always, but most probability means 75% or above or 80% above 80% above times, all of the above will be the correct answer, because and also this all of the above option will become 100% correct if you find a remaining three options. If any two options are somewhat similar to each other, then that will give more weightage to the all of the above. Because there are two options which is more comparable, more similar, then both cannot be correct answer. So then all of the above only will be correct answer. If you face any question with all of the above, most probably that will be the correct answer. Keep that in mind when you are facing difficulty in this type of questions. Then comes none of the above. Just opposite to that, if you find none of the above, it is usually incorrect response. What happens when question is being prepared? None of the above is added as just like one distractor, which is not. See, when I prepare a question, there is a stem. I prepare one correct answer, three distractors. So preparing each distractor is a Herculean task, because the distractor should not be the right answer. It should not be the right answer, and also it should be very, very close to the right answer. It should not be the right answer, and it should be sounds very close to the correct answer. That's why it is more homogeneous. So very difficult to develop such questions. So after developing two distractors, I may go with the last option, none of them. I'm in mind, I know that it is not the correct answer. A good paper setter avoid all these things. Nowadays there are good quality control, all of this. But if you find such questions, none of the above options is often an incorrect response, because this is very, very less reliable. Then this technique has to be very judiciously used with a lot of application. Don't blindly go for it. The longest response among distractors is often the correct one. Again, I'm telling you, warning you this, knowing the answer is correct way, you must know factually. You should not use these techniques if you know the answer beforehand. But none of these works. You want to attempt the question, often you can take the chance of giving the longest response as a correct answer, because most often it is correct. Because often when the options are prepared, when it is prepared comprehensively, it becomes lengthier. So the longest response among the distractors, often the correct one. This technique you can use sparingly, judiciously with a lot of application. Then look for grammatical clues sometimes. If the stems ends with A or AN, more smart paper setters will give A/AN, then there is no use. See, if it is, one second. If it is A/AN, then anything can be. But if it is only AN given at the stem, last of the stem, then you are looking for the answer which is starting with the vowel, because and will come before the vowel. But mostly they will avoid that, this kind of silly mistake. But very, very rarely this kind of clue appears. Look for verbal associations. A response that repeats keywords which are in the stem is likely to be correct, like what we have seen in the levothyroxine and T3, T4. So look for such verbal associations. So can we run this poll? Let us see. You follow the strategies what has been discussed so far and answer this question. Let us see. I expect 100% correct answer in this. Read the question carefully, read the options carefully, follow some of the strategies which I have told you. Very tricky question. I expected more good correct answer, but what the trend is not that correct. So far, the trend going on is not in that direction. That's what I said. When I think you are more confident of knowing the answer than the strategies which I have discussed. This is where you go wrong in the examination also. That's why it is very, very important to undertake these polls. Please, as much as possible, please take the polls. Don't just be a listener. Right, I think 103 people have voted, and can we expect more? No, I think only 103 people are actually interested to take the polls. Others are only listening to you. I think you should start working hard in this area itself. You first of all show commitment. Be an active learner. That will improve the possibility, increase the possibility of your success. I don't know, maybe some of you attending maybe in the mobile or having difficulty taking these polls, I don't know, but only half of you are responding to the polls, so rest of you have to participate actively. So let us take, first of all, the majority 46% of you have answered wrongly. That is this option B, administer. If you have any queries about it, you can put it in your chart. We will answer at the end. You have answered as administer prescribed analgesics and elevate the stump. See, the correct answer is still 33% of 34% of the people answered correctly. That is option C. Please publish. Answer is published. The answer is 4. First of all, I tell you the scientific reason and then I will tell you the strategy. First of all, the question is about complaints of pain. Here, there is nothing about edema, discomfort, nothing. Only, see, if it is first 3 days, after 3 days, it is not first 24 hours days that elevation of stump. Complaints of pain in the amputated limb. Okay, so the attention is for the painkiller. So you went for the administer prescribed analgesics and elevate the stump. But the more comprehensive answer is D, because administer analgesics as ordered, because both are comprehensive. Here also administer prescribed analgesics and here also administer analgesics as ordered. Both are correct. But here the added point is encourage use of mirror therapy. You may be unaware, the mirror therapy used for the, what pain? Phantom pain. The patients with the amputated knee will have phantom pain. For that, the therapy used is mirror therapy. So the fourth option is more comprehensive than other. It has more than one intervention. Both are related to the pain. So there are two strategies here. One is more comprehensive. Option 2 is it is lengthier option. Because it is comprehensive, it becomes lengthier. So in this regard, the answer D is correct. I'm happy that 34% of you answer correct, but 46% of you have relied on your knowledge about pain. You went for analgesics and elevate stem, but you missed the mirror therapy point. And also, whenever you are getting confused, at least 2 options are related to pain. Eliminate for A and C. You are stuck with B and C. Both are talking about analgesics, but one is talking about, apart from analgesics, one more therapy about the pain related to the phantom pain of amputated patient. Okay, so that should be the correct answer. Yes. Yeah, elevated stem, again you have to note that is only for the 24 hours. Thank you for the input from Ms. Ambly. So the next poll can we run? I hope this should, at least you should be able to. I have highlighted here, use the keywords which I have discussed about always, never. If you listen to the class, you'll be able to get it correct. Publish the next question, please.
Please run the next poll.
This question is going another. I think now you got the point about this strategy, but it will be very, very useful strategy when you face NCLEX type of question. If you are taking NCLEX examination or see NCLEX type of case-based scenario question, it will be very useful point. And almost whoever attempted so far, I think more number of people started. Now I think my the previous statement worked. Now 127 appeared, and can we see the poll result published?
Yes, I request the backend team to please publish the results.
Yeah, already published. 92%. I expected 100%, but last few have gone wrong. Up to few attempts, it was 100%, but the last few attempts were wrong in. I think only 2% went for the option 1, and another 4% went for option last option. But rest all of you are correct using the right strategy, because see, some of you gone for the D option. I tell you, all patient always require contact precaution. Not possible, not required. All patient always. Use the keyword always. Here you see the always and never. Most often, even if you don't know the answer, effectively use these strategies. The question, hand hygiene should usually be performed before and after each patient contact. That is the protocol. Okay, so that is the correct answer. One thing is that we found the keyword usually, so that increases the chance. Second, it is more comprehensive than the other options, and also it is lengthier. See, many of the strategies works all together. You will be able to solve this question. Even if you know the answer, you can cross check with these strategies, but don't use this strategy at first hand. That's what my request is. So we move to the next question, next lesson. Consider negative marking and be judicious in using these techniques. I already discussed about this, don't want to repeat. Whenever there is a negative marking, be judicious. I tell you, I advise, mostly if 1/4 is the negative marking, if you are able to eliminate one option, it is right. Or if I am attending the examination, I will go for it. Okay. But if I am unable to eliminate at least one option, totally confused, maybe the question is related to the year, recalling a year, recalling the name of the scientist or the theorist. I have no clue. I cannot attempt. I will leave it. If I am unable to eliminate even one option, there is no use attempting it. That will increase the possibility of error. But if you are able to eliminate at least one, is better mathematically, it is okay to attempt. That's what my suggestion is. You have to make your decision, own decision. If two options, this option, please be carefully analyzed. I will be showing two examples in the next polls. It is very, very useful. I have seen, I will show you the question which is real time. It means in the previous examination, it has been asked. I brought those questions only. You can solve using this strategy. If two options are exactly opposite to each other, then most probably any one of these two is the correct answer. For example, hypotension and hypertension. In the symptoms you want to find out, if there is a hypotension and a hypertension, any one of this should be correct, because these both cannot coexist, right? So such clue you can look for. If two options are opposite to each other, then among those answer is there, any among these two. And if two options are very, very nearly similar or close to each other, then both are not the correct answer. Because if both are correct, then you have to look for all of the above option. If that is also not there, then two of the similar answer and both are not correct, then the correct answer is hides in other two options. Keep this in mind. You cannot answer a question within a minute. Sorry, if you cannot answer a question within a minute or less, nowadays sir, for 20 questions you have 18 minutes. Even 1 minute is more. If you are not able to answer in 45 seconds, move to the next question. Then if you have additional time at the end, you come back skip it and plan to come back later. So following these strategies, try to answer this question. All of the following statements are true about SIADH, syndrome of inappropriate antidiuretic hormone. All of the following statements. Next poll, please. All of the following statements.
Poll has been started, sir.
Yeah, SIADH lab values. SIADH, I tell you, syndrome of inappropriate antidiuretic hormone. Except, that means you are looking for a positive. All of the following statements are true about SIADH, except. That means what is not true about SIADH? This is somewhat tough question. That's why distractors are good too. But if you use the right strategy, it is not. I told you, two options, if opposite to each other, option will be lying between that. That means C and D. Both are opposite to each other. Decreased plasma osmolarity, one is increased plasma osmolarity. So option is lying between these two. You should understand, is it? Quickly, some more answer we are expecting. Quickly.
So far, sir, 42% have participated. So we're giving you more time for this. This one question is a little confusing.
Yeah. You have to find that. See, even if the answer is between, I'm telling you already C and D, because both are opposite to each other. I told you, if two options are opposite to each other, most often most often answer lie between that. Use that strategy, so the option will be between C and D. Rest is your scientific knowledge. That's what scientific knowledge is, very, very important. You cannot directly apply any strategy. Can we see the poll result? I am unable to see this.
Please publish the results.
Yeah, 58% of you gone right. SiADH cause increased plasma osmolarity, which is not true, because we are looking. See, that's what you confuse you. Here is actually there is a negative question. All of the following statements are true about SiADH, except, that means we are looking for what is not true about SiADH. What happened in SiADH? First of all, the urine osmolarity increase. Okay, what use osmolarity increase because urine become concentrated. There is increased ADH secretion, so urine become concentrated. When urine become concentrated, sodium also increase in the urine. So that also correct about it. Then when SiADH cause a decreased plasma osmolarity, that is also correct, because the plasma become more liquefied, because water is retained. The retention of water happens because antidiuretic hormone is increased. So all three are correct. So we end up with the SiDS. But here only one clue is that you can easily eliminate A and B using the clue. If two answers are opposite each other, you are looking for the answer between any one of these. So you are looking for only between C and D. If you analyze bit and if you compare the A and B, which A and B are, see, both are somewhat similar, you can see. Urine osmolarity increase means sodium concentration also increase. So if this happens, what happens among C and D? If you compare and take one among A, B, so one either C or D to A and B, then automatically you end up with the D. That's how you have to use this strategy. I'm happy that 63% of you are correct in this question, but 20%, I also appreciate that other 20% you at least landed in C. So 63 plus 20, 83% of you used this strategy correctly at least. But 63 of you combined the strategy with the scientific knowledge. So 63% of you are correct. Next question, use again the same strategy. Both the strategies are used in this question. I expect at least 100% in this using, because both the strategies are used here. Please read the question carefully, answer carefully, then go for it. The strategies, if two options are similar, both are not correct. Other strategies that two options are opposite to each other, most probably the answer between lies in between these two. Despite following my, this is the last question actually, in fact, despite following my lesson, and I'm keep insisting this strategy, you are not using that strategy. Is it? Can we publish the result? Can we publish the result? Yeah. You see, 73% of you went for, or 75% in fact, went for opioid analgesics, which is the correct answer. And other 12% went for non-opioid analgesics. You should have used the second trick, so you could have reduced. So now I will explain you why it is. For example, first of all, I said two similar options. If you find two similar options, both are incorrect. NSAID, that is, I did not even read the question, you see, which of type of analgesics are commonly used in ICU. NSAID means non-steroidal anti-inflammatory disease, drugs, which is also known as non-opioid analgesics. Right? So both are similar. If NSAID is applicable, then non-opioid analgesics is also applicable. So both are similar. So both are not correct. Then I told you another clue. C and D are very opposite to each other. You see, one is non-opioid analgesics, next is opioid analgesics. So I told you among these two, any one is correct answer. So when you use the second clue, this is not correct because there is one another similar answer. If non-opioid is correct, then NSAID also to be correct. That's why both are not correct. Then automatically you end up with the opioid analgesic. This question also asked in the previous examination. I will not name which examination, but it is also asked in the previous exam very recently in the last couple of years. So 79% of you are correct in this, and 157 attempted this poll. This is the last question. I appreciate your participation in this. So now what I'm telling, don't apply these strategies all of the sudden into the examination. When you are practicing, apply this. When practicing, first of all, you read the question, you read the option, you know the answer, answer it, no problem. But when you don't know the answer, you find the question is very difficult, you're supposed to leave the question because of the difficulty, then try applying. Is it applicable? Whether ABC principle is applicable, whether CAB is applicable, whether actual to potential is applicable, whether nursing, whether it follows the principle of nursing process sequence, whether the two options are similar or not, or whether two options are opposite to each other, so I can use that strategy, whether you look for the stem, whether except not is present, so that you're looking for some clue. You try to find some keywords in the stem and try to connect it with the options. Apply any of these. If you are convinced following these strategies, you are able to, if not able to find the answer, at least you are able to eliminate one or two options, then you can confidently answer. That increases your success rate, or in other words, it reduces the possibility of error, it reduces the mistakes, that at the end of the day, when you come out of the examination, when you miss the paper in the examination by 3-4 marks, then you know the value of making that silly mistakes. This is all about avoiding such mistakes in your examination, right? Then we move on to the do's during examination. During examination, read the question carefully to avoid silly mistakes, which I already told. Look for the double negatives, look for the negative terms. Attempt easy question first, even if it is within the time frame. First of all, attempt all the easy question, then reserve the difficult question later to try reading twice and apply other questions, and attempt difficult questions later. Attempt judiciously when there are negative markings. And what you should not do during examination is, don't rush to read the. Some people, after seeing certain keyword, oh, I know about it, immediately they'll see one option, they will tick it. You have to read all other options or to ensure that what you have chosen is the most appropriate answer. There should not be any better answer than that. Never attempt a difficult question first, which we have already covered. Don't attempt any questions randomly. Go with the sequence. If it is difficult, skip it, come back later. Don't randomly attempt by clicking this question, that question, lead to a lot of confusions later. Don't rush to mark the answer. Don't waste time by forwarding and rewinding the questions in an attempt to review all. Some people have the habit, I want to see all the question once, 1 to 20, then I will answer from the first. That will waste your time. Don't do this mistake. Okay. So this is all about the session. I hope this may help. See, I am not telling because of this session you will be able to, you have to study hard, you have to work smartly, but also while you are practicing, follow all these strategies and all those planning for studies subject wise. You know the important subjects, know the important topics before you start your planning and preparation. So that will lead to the comprehensive preparation, which increases the chances of success. In other words, that will minimize your errors when you are taking examination. And once again, I thank you very much for the CBS, and I think we are going to announce the winner very
Yes, sir.
shortly.
So we had,
All,
before sir
to all
announces
the,
the winners,
to all the
sir,
readers, once again,
I'd
madam.
like to inform everybody, all the participants, that we had one quiz running from November 1 to November 7. And all those participants who participated and scored the highest, we had a lucky draw for them, and sir is going to now announce the winners. So please go ahead.
Yeah. Also, I encourage all of you to see, many of the people I did not take the poll, but they were answering in the chat box. I think that may be a misunderstanding, and some of the people have posted some queries in the chat that we will answer at the end. I encourage you to put more questions if you have any doubt. I'll be very, very happy to discuss next 10-15 minutes, or as long as you are available to discuss the question and answer session. And also I thank all the participants for giving us so much of support and supporting the target high also. So I'm going to announce the winner. Can I announce the winner, madam? Three winners of nursing prep blocks. After your sorry, I'm going to announce the winner. Can I announce the winner?
Yes, sir, absolutely.
Yeah. The winner number one, Sohail Bangru. Sohail Bangru. Are you available? Sohail Bangru. Winner number two, Vinay Kumar Mishra. Winner number three, Gautam Pradhan. You can also list the names in the chat box also so that everyone aware. Number one, Sohail Bangru. Number two, Vinay Kumar Mishra. Number three, Gautam Pradhan. So I appreciate your continuous and consistent participation in this. Congratulations to all the winners. You have any specific queries, please post it in the chat box. We'll be very happy to discuss those doubts. And your feedback
Sir,
is
apart from these winners, we also have 3 more winners who are above, from a lucky draw that we conducted among the registrants. So I'll announce those winners. So these are Narijana Parvin, Ekta Aharwar, and Krishna Mati. So congratulations all of you from CBS. You've been announced as the winners, and I am also happy to congratulate all the winners of the quiz that was associated with this webinar that Sir has just announced. So congratulations. And now another lucky draw is still happening. It is in process, and we'll be announcing them shortly. So just I'll take a break here. Sir, if you would like to say something, your message to the participants, you're please welcome to do that. Till then, we'll announce, we'll go for a little break, and then we'll announce all the third category of winners.
right. Okay. Yeah, some of you posted a question. Like 1 second. Sir, while preparing from the beginning, should we solve questions every day for the PYQs, previous year questions? That is a very good habit. When you start preparing, usually you have to build your concept first. You have to prepare your theories first. So while preparing theory in the same area, if you that's why it's important, instead of going to randomly answer the previous year papers, if the questions relevant to your same subject which you are preparing, right? For example, you start with the fundamental of nursing, start solving question from fundamental of nursing, so that your theory preparation go in line with the practice, so that you will be able to connect the questions from your theory concept. That is the right way to go. See, some interesting
Sir, you will have to stop sharing your screen, because at this point your screen is being shared.
Okay, I will close it.
Click on the stop sharing. Yes, you forgot to do that probably. Yes, sir.
Thank you.
Thank you, sir.
Thank you. Yeah. Now there is one more question. Sir, how to find right answers when all 4 options are similar? So very interesting question. Mostly the most difficult questions are looks like that. All 4 options looks very similar. Only one option will be little bit different or very accurate to be the answer. That's why we have to find. That's why in the beginning I said there is no alternative to knowing the answer. There is no alternative for having a knowledge about that question. These strategies will work only when you have no other option. You are unable to solve the question. Try these strategies. That's all. But even then, even all are similar. If you look at any of these, similar is fine. But you will be looking for any of the. See, if the question option is one word or direct recall, there is no clue. Unless you know the answer, there is nothing can help you. You have to work on it. You have to study. But if it is a scenario based, case based question, especially nursing intervention based question, there you find any of these most comprehensive answers or the lengthy answers or the similar or comparison to options. These strategies may help only in those type of questions. So somebody asked, sir, is synapses of target high enough? So as an author, I would say yes, but most of the high yield topics are covered enough. Most of the high yield topics are covered enough. And if not, in the questions part, it might be covered. But if you want to be more confident, you want to increase that, a depth of knowledge, then you can follow other standard textbooks also, I don't deny. But mostly if you are very thorough with the synapses content, that will cover at least 80% of the content. I will not say 100%, 80 to 90% definitely, because always there will be a surprise in any examination. Some new questions will come, definitely you have to be prepared for it. Sir, how we start? Other question is how we start preparing along with the clinical duties. You are talking about, I think you are a student or you are already passed out and you are working in hospital. In that case, first of all, I'm not clear who is that, but let us take the first scenario. If you are already a nursing student working in the going for a clinical posting, it's not possible to prepare full time. You cannot spend 6 hours or 8 hours in a day, but you can allot at least 2 hours in a day to daily practice the question. So because during the study period you have you have less tension in the sense you have no job pressure. When you are going into the full-time preparation, every exam if you don't pass, you get into so much of pressure. But when you are studying, you are preparing for the examination which is going to come. We are in the regular BSc program. You are preparing for an examination which is going to come next 1 year or 1.5 years. So you are less tensed. Every day you practice 50 questions from the subjects which is usually taught in your college, and you go and prepare specifically half an hour of preparation, maybe another 1 hour of practice question will help you a lot. But you cannot practice more than that if you are in a clinical duties. But second scenario, if you are working full time, and I know how difficult and how demanding the nursing job is in the hospital. When you come back, you'll be very tired. So that will you will not be able to give more time for preparation. So if you are in a private job and with the less salary or something, and you have to make a call which is more important, because if your duties are affecting your preparation, if you are able to manage both, otherwise you will not be able to if you are able to manage both, it's fine. Otherwise you will be able to, it will be very difficult for you to manage it is very difficult to for you to give more time for preparation in a given day. Please focus on management and research nursing education. Of course, management, nursing, research, nursing education. I think someone, Ravi Prakash Jangir, asked this question. Usually, management, research, and education questions are mostly asked in SMO papers, ANS examination, as well as in the nursing faculty entrance examination. In the nursing and NORCET or other papers, the questions are very, very less. But even though in the target eye, these areas are covered sufficient enough. But if someone is looking for extensive coverage of this nursing education, management and research, you can buy Target High MSc entrance. I don't think many of you may not be aware of that. You can use Target High MSc entrance book. That in that subject, these subjects are extensively covered.
17%.
So, sir, I have financial problem for purchase Target High book. Please PDF. That is not actually possible. It is out of question. So how to do
For that, anybody who wants, complimentary books, you can go on participating in the so many quizzes that,
you
CBS
can
organizes time and again, you'll get one of the complimentaries.
correct,
So that is
exactly.
the
You follow our page and participate in the activities. One day you will definitely get a complimentary copy. That will be
definitely.
more useful. And don't encourage the piracy and PDF, because someone's effort is behind that. So how to do time management during my undergraduate nursing right now? I'm in third year. I already told you, when you are in the third year, focus on your studies, but every day you can focus at least 1 hour or 2 hours for the competitive examination. That will be the very right strategy. As soon as you pass out, you will be able to clear, because you are in the right track if you are doing that. So I clear my prelims but failed to qualify mains. Please guide, sir. That's what I said. Preliminary, the more number of shortlisting happened. In mains, only number of shortlisting is less, and also there are more clinical based questions. Of course, in the preliminary also clinical based questions are there. I think you have to improve yourself. Maybe another 5% improvement or 10% improvement will take you to the mains also. So best of luck next time. So how often do nursing tutor vacancies occur at AIIMS? Someone asked. Nursing tutor vacancy depends on the vacancy arises in the institutes. In the new institutes, all the vacancy will come. In the old institute, if there is a resignation or promotions, those vacancy will come. You have to keep looking for, you have to keep visiting the respective AIM websites to find, because other advertisement like NOSA, TSIs are not widely advertised. Sometimes the tutor vacancies and all go unnoticed because you have to keep checking the websites of the respective institutes. So, sir, while doing MSc, how to manage time for preparation? I think it is by Shreya Biswas. I think she is one of my MSc students. I think, is that so, Shreya Biswas? I hope it is correct, because one of my MSc student name also Shreya Biswas. If you are doing MSc, and I know you are stuck with data collection, you have to do clinical duty and all those things, and you spend at least 2 hours a day. You spend 2 hours a day, at least you allot 4 to 5 hours in a day for studies, 2 hours for this competitive exam, rest of 2-3 hours use it for other purposes. So both you, at the end of the day, end of the year, you become postgraduate as well as you are ready for facing competitive examination. You can face both. Is there any other book that we have to read alongside with a target high, or reading target high is enough? I would suggest, see, target high is very comprehensive book. I would say in any examination, 80 to 90% coverage is there. Either the question will be there in theory, indirectly, or in questions indirectly or directly. So far, after every examination with the memory-based question, I analyze the content of target I through the soft copy, through the search. I find 80 to 90% target rate. So definitely, you will be able to cover it. If you want any additional preparation, maybe you can use now even the 8th edition we have introduced the app, so you can take anytime in your hand, you can prepare, and more than 100 previous year papers are covered in the app freely for everyone. And if you are a paid subscriber, you can use all the previous year paper in practice mode and review mode also. And also, I would suggest, I will not be very selfish to only promote target type book. If you look for more of N-class question, all those things, you also, along with that, you can read Saunders books kind of thing for N-class based question. But in future, we are planning to come up with the N-class question book also, God willing. Sir, how can we choose the correct option from same ABC sequence when two options are same? Then that's what I said. If the both options are related to A or both are related to B, I asked you to use the ABC sequence. If two options are related to A or two options are related to B, there are two ideas you have to get. One, whether what is actual and what is potential. For example, right now the airway is blocked, that is actual. There is a potential for airway blocking is a potential problem. Both are airway, but one is actual, one is potential. Number one. Number two, look at the intervention, whether it is nursing related. Sometimes there will be an intervention which is need to be given by the doctor, but other intervention is related to core nursing, intervention, core nursing skill. Then focus on that. You can use other strategies. Okay. Sir, which edition is best? I would say 8th edition, because that is the latest edition. Maybe all updated questions up to the recent, and also you get a free app along with that. I would suggest the 8th edition only. Some of one other person has already answered that question. Is it important to do NCLEX after target high? Target high question, we have included a number of case-based questions to cover every area. But if you feel I need more after completing target I am very thorough with that, I need more focus, you can try some more questions also in NCLEX based question that will improve your accuracy rate. Sir, is it good to use AI for more preparation and easy learning, or should we stick to books only? I don't suggest. AI make mistakes. Even if you give a MCQ, I'll tell you, you do this exercise, copy paste one of the MCQ to AI, it will give the answer. It may be correct. You say that it is not correct because of this reason, it will accept your answer and change the answer. That much only AI can do. So AI cannot be used for the preparation, that you will land up in problem. AI right now are inaccurate in this case, so don't trust on AI particularly for this particular purpose. Okay, and even if you ask AI to prepare some question, it will prepare very vague questions where even a first year BS nursing student can answer the question, but it does not follow the principles of making MCQ. So how many questions should the candidate attempt? And at the end of the day, we want your feedbacks also about how to improve the book, as well as how do we improve these strategies, about your feedback about this session also, so we can have more sessions in future. So how many questions should the candidate attempt for the mains exam for to be safe zone in the top 10? I don't understand the question. How many questions you attempt? It depends on, see, it depends on the difficulty level. If the questions are easy, you should at least attempt 90% of the questions. The questions are difficult, you should judiciously see. It's not about how many questions you attempt. I see some of the interview I attempted 140 questions, 150 questions about the toppers interview and all. It's all about what you have prepared. See, some people may have attempted 140 and getting 130 right. Some people may have attempted 180 and getting 160 correct. So 150 correct. They will be more benefited because -1/4, +1, and you judiciously attempt when there is a negative marking. That's what I would like to say. If you are able to eliminate, try to attempt. If you are not able to eliminate any of the option, better leave it. That should be the strategy. Number of questions, don't target number of questions. Okay. But first attempt all the questions for which you know the answer. If you are in the zone, for example, if you are already after attempting all the questions for which you know the answer, you already crossed 80% of the questions, and your 85% of questions are covered, and the rest of the question very carefully, very few you can attempt if you are able to eliminate two options at least. Otherwise, don't try. But after attempting all correct questions, you attempted only very little, and you are not even covered 50-60% of the paper, then you have to attempt more questions. Otherwise, you will not be in the competition at all. Sir, is the theory content same in Target I, NORCET and MSc book? MSc book, the theory content is different because there is advanced nursing practice subject added. The research is expanded. The nursing research, the education and management subjects are expanded. More questions are there in this subject. And other subjects are concised. Because if you want to read other subjects like medical surgical fundamental, better to choose Target High. If you want to focus on the MSc related subjects, you focus on MSc Target High MSc nursing book. Okay. Good evening, sir, and I request that there should be any webinar regarding routine for students to make the study best for our studies and career. We'll keep it in mind definitely. Sir, I got 2,274 in NORCET 9, dropped by 0.5 marks. This is what very, very important. I tell you, how many questions you attempted, I don't know. And what is your negative played a role, I don't know. Sometimes you may feel that I attempted more questions because of negative I lost this 50.5 marks also will be there in your mind. That's what you have to attempt carefully the questions when you go for blind attempt or random attempting without considering negative, all those things. Okay, so best of luck. Next time you will be within the target. 0.5 is not big, so focus where you committed mistake. Focus on where you committed mistake. Try to improve those shortcomings. You will be successful next time, and all the best. Sir, please example how solve questions based on Maslow's hierarchy theory. Again, Maslow's hierarchy theory. Yes, again, if there are, I think I missed this point. Thank you for notifying this. Whenever the question related to Maslow's hierarchy, or whenever you are asking for the priority nursing care, first of all, see, ABC itself Maslow's only, because that is within the physiological needs. First of all, physiological needs, then safety, security, then go for love and affection, self-esteem, and self-actualization. You have to follow this order when you are choosing the priority. I got selected no certain, but I want my dream aims. How I manage time? Sorry, how to manage time with the job. Okay, right. So, for example, this student, I think Miss Priyanshi, have already got job with the 9, but she did not get her favorite aims. Okay, so she's in the catch 21 situation that she want to continue the job where she don't like, and she want to prepare for the next examination also. So how to manage both? So I think you have to keep the job what you have got definitely, but you will be in the shift duty. You will be having a different shift duty. It will be hard work. I know it will be a demanding job, and also there will be a lot of stress while you are adjusting to the job. But you are already bright student. You have already cracked the examination, so it will be easy for you to push ahead. Okay, so keep your preparation. At least prepare. See, one day you are only leaving the night duty days. Other duties are only 6 hours. maybe traveling for another 1 hour, you can keep preparing for another 2-3 hours in a day, so that you will be able to achieve your target in the next NORCET 10. And all the best for that. Can you provide some tips for tackling difficult questions? That's what we have so far discussed. And managing stress during the exam. Stress during the examination, be focused. Stress is good. Don't misunderstand. Stress is bad. Stress is the only thing will make you to work. Stress is you are all under stress. You want to get good marks in the next NORCET. That's why on a Saturday afternoon, you are sitting in front of the computer or in front of the system to attend this class. Only because of that stress only brought you to this class. The stress only making you to read. So stress is good, but manage the stress need to be in the optimal level. It should not be extreme distress. Have some stress. Use the stress as a energy to work more. Okay. Thank you for guiding, sir, sharing. Okay. I only answer the critical questions. There are a lot of roses and flowers appreciation that I keep it with myself. I answer your question only. And how many competitive books we should read for NORCET? That is depends on your preparation. Okay. So how much you practice? First of all, you get mastery in one book. Then you find, okay, this is also not appropriate. Still, I get questions beyond this book. Then you try other books. That's what our target is, to crack NORCET 6 months. How many hours daily preparation is required enough? It depends on 6 months or 3 months. How many hours you put on? It depends on your commitment. How much time you are giving. Don't always look at the smartphone. Don't scroll through the reels. Don't get distracted. Focus. After getting job, you scroll a lot of reels, you see a lot of short videos. Till then, keep the mobile away, because that is a big distractor. Even that will reduce your memory. A lot of studies says that reduce your memory. Keep focusing on the subject. 6 months is a very long time. You can complete target a book twice in 6 months, and all the best for you. Daily 6 to 8 hours you have to study at least with full concentration. See, it is not about how many hours, how many quality hours you spend in preparation. How many quality hours you spend in preparation. Okay. For preparing nursing tutor exam attempts, which book I should refer? I would say Target I for other subject, and for management, research, ANP and education, refer to Target I MSc. Free of app सबको मिला के sir. Whoever buying the Target 8 book will be able to access 50% of the Target 8 digital app. Now very much improvised. You can even create your own test. You can go to the app. You can create your own text with number of questions. You can choose number of questions. You can choose what subject you wanted, how many questions you wanted, what difficulty level you wanted. You can choose all these. Then the test will appear. You can take the test. In other words, you can create your own mock test and get trained. That option is also available, but that is only for pro users, and that option will be shortly activated. Right now I am not activated. Very shortly it will be activated. That will be for pro users, paid. But for book buyers, 50% of the options are applicable. 50% of the content will be available for free if you use the scratch code. Then second edition MSc Target and somebody asking. So second edition will be better. Okay. So right. Should I start directly solving MCQ or start learning the basics? I say both side by side. Start learning basic, complete the basic subjects, and I mean anatomy, physiology, microbiology, biochemistry kind of basic. Come to fundamental. From that point onwards, parallelly study a topic, solve the question related to the topic. In Target even we have segregated the questions topic wise. Even now brought the previous year paper questions into the topics. For example, if you are studying about BLS, ALS and go to the MCQ section of BLS, ALS, you will find all the questions from the BLS, ALS from previous year paper. So you will be able to practice the previous year paper question, the question related to BLS, ALS while you are studying about BLS and ALS. So that's how you have to practice also. The difference between 7th and 8th is this only. I brought all the previous year paper from the previous year paper section into the subjects and topics, so that when you are preparing certain subjects and topics, there itself you will know what are the questions from this subject and topic asked in the previous year. Questions you will be able to prepare together. That is a major. And the assessment and reason question has been added. The match the following type question has been added. There are more question, number of questions have been increased. These are the differences. Right. Sir, currently I'm in 4th year intensive. What should I and how should I start the preparation? It is right time to start so that you will be able to cross the destination, reach the destination within next 1 or 2 attempts. So you start preparation right now. If you are in intensive, it is a right time to go for preparation, because 4th year, apart from intensive, your workload is very, very less. So right time to prepare. I think this ends all the questions. I answered more relevant questions. There are many appreciation and thank you that I did not read. I keep it myself. There are some sarcastic message also, which I keep it to for you also. Thank you very much for the listening to me for the last almost 2 hours, and almost 250 plus participants constantly attended these sessions. And
Sir, but we won't let you go like that. I hope I'm audible.
Yeah, you're audible.
Yes, sir. So I would like you to talk a bit about your new book, the nursing research. So just very briefly, because then I'm going to introduce all the people to your new book also. So we won't let you go without that.
Yeah, right. So you want me to talk about? Okay, I have an authored research nursing research textbook published. I think last year it was published. So nursing research textbook I have prepared with my co-author Sukhpal Kar, who is principal College of Nursing, PJ Chandigarh, and we have written a very practical based textbook on nursing research. If you are into the 3rd year in the AIMS institutes or 4th year in the other institutes, you must the nursing research is one of the subject, nursing research and statistics. So I prepared that content of the book very practically with all practical aspects, especially research design, the randomization, how to randomize using computer system. Every aspect is being covered. I hope that will be very, very useful for you. So if you have time, please go through the book, and it is very simple language. I have provided the book with a lot of examples, which is very, very practical. So I hope it will be very, very useful for you. The textbook name is Nursing Research and Statistics. Thank you.
So very quickly, I'll request the backend team to play the video that introduces to Sir's new book, Nursing Research, and then we'll announce, we'll talk about the next set of winners.
Yeah.
So that was about Sir's new book, and we'll like to conclude here. Am I right, sir?
Yeah.
Since we're already running short of time, so and a lot of you have participated in the polls that were conducted by Sir. So we'll announce the results on Monday, and the winners will receive mails from us, mails from our PR team, and we'll be communicating with you on Monday.
Yeah, and also I request organizers to send the e-certificate promptly to all the participants, because that also will help them. That is a motivation for them. So definitely,
Yes,
please send those certificates. Okay.
Definitely, sir. So the CBS team will be in touch with the participants. We'll be sending you the webinar certificates also, the participant certificates, and the participants who won the quizzes and the polls and the lucky registrants, they will also receive their books. So we'll try and finish up this thing very early, as soon as possible.
Okay. And I thank all the participants for your valuable time to spend on this Saturday evening. Thank you.
Thank you, sir. Thank you for being on CBS Author Talks Live.
Yeah.
So we're concluding here. All the participants, stay tuned. We'll bring on more authors on CBS Author Talks Live. And we'll not end up here. We'll have more talks, more insightful discussions. And that is it from CBS Author Talks Live. Thank you.